So we are here with health transformer Daniel Penn,
Hey.
founder of Tickit, formerly known as Shift Health. So you've changed your name from Shift to Tickit.
Yeah.
And Tickit was the name of your product,
Yeah.
so it's a natural sort of evolution.
Yeah.
What's the vision? What's your moonshot? What are you working on with Tickit?
Yeah, so we help healthcare systems improve outcomes through patient-reported data. Our focus is on transforming the healthcare system so that really the patient voice is heard by the system, and that we can really move the system towards a patient-centric care by amplifying that voice.
And you're in Vancouver.
Yes.
Actually, we're in Toronto.
I was, yes.
And so talk about where you are as a company, how things are evolving, how things are going.
Yeah, so overall it's been exciting. It's been a really exciting 6 months. We've grown from 6 to 13 people in Vancouver. We've set it up our headquarters there, which has been really good for us. I'm originally from Vancouver. My co-founder's in Vancouver, so we've been able to solidify the team and the culture there. And it's enabled us to really focus on the Australian and New Zealand market, which is expanding for us. So it's no longer a 5 and then a 12-hour flight. It's now just a straight up 12-hour flight. We have a lot of clients on the West Coast, so for us it's been a really good strategic move.
Take us out to how your customers are really benefiting from this platform. How are they using it? How are they benefiting? What's the feedback you've been getting?
Yeah, so what we found is that our customers have been able to actually be 4 steps ahead of the visit when the patient comes in. So both patient and provider are prepared when the patient walks in the door, and they've been able to catch things that they've been looking at. So for suicidal ideation, we've caught clients across. That's been a really big area especially for youth mental health, which is a growing issue. It's doubled, and for me, it's kind of the reason why I started the company. That's been something that we've found across Canada and our clients in Australia. But being more prepared and being able to have better engagement with the patient and just making a more comfortable visit for both sides, especially around uncomfortable areas like depression and mental health.
And so as you're building your customer base, who are you generally speaking with? Who are you targeting when you start the process?
We're a physician-founded company and a physician-led company. So my co-founder is a physician, and we really go in from like a medical background, understanding the workflow and working with the medical director directly. What we've actually found is that we started kind of on those individual clinic basis, and now we've expanded out, and we're now working with departments of health, talking to the Ministry of Health in a few countries to talk about global scale, like a kind of a much larger scale. So what we've found is that the product itself has that scale, and especially specific tools that we've developed. Really, if they're looking at youth and mental health, we have a highly scalable product in that space, and we're building that out for caregivers in other areas as well. So we're moving up, I guess, the food chain in that regard, going to where closer to where the money starts instead of just where it ends.
So you made a lot of progress over the last few years. Focusing on the product, new customers, your team's growing. What have some of your biggest lessons learned been, wisdom that you might pass off to other health transformers, other entrepreneurs just getting going?
I think it's a long process that takes a lot of time to learn and develop. I think for us, we've been around for about 5 years. We've gone through quite a few iterations as we've moved along, and we've learned along the way. It's a new space that everyone is still trying to figure out how does this scale, what does this actually look like, where is the focus going to be? So asking questions and being able to see where you can add value by truly understanding the problems that people are facing is like where we've tried to focus and continue to focus on. So that goes everything from using designers and design thinking to and having a very embedded team where everyone on our team knows the problems that we're solving. So we're a very close-knit team, and we try to keep it that way where
is everyone in the same space?
Everyone's in the same space, and every 2 weeks we do a demo where everyone from sales to product spends a minute talking about what they've done in the last 2 weeks. And it goes from me as like the CEO down to our co-ops. And we get to see and actually experience what they're doing, how they're adding value. The product team gets to see what's happening with our clients in that regard, and on the management side, we get to see what's actually happening on the ground and the technical things that are working in that. So having that cohesiveness really helps us tackle some of these larger problems that the health systems are facing.
And as CEO, how are you measuring success? What metrics do you track that signal you're moving in the right direction?
So I think it's impact. We try to look at kind of the impact that we're having. So for that, we look at academic papers that have been published, not just by us, but our clients, and the impact that they're having. The ability for them to scale within the organization, where we work with a champion. And then they're excited about it, but can they take that to the next level? That's a huge part for us. And then I think the other side is that engagement that we have from our personnel. Like, this is a slow, 12-month sales cycle type of business. With young staff, it's really hard to keep them that engaged over a period. So making sure that everyone feels every win and is included in that regard, so that the next generation of people that are going to be tackling these issues in digital health are excited, aren't coming out of a startup in this space burnt out, but have the opportunity and the skill set to make an impact, maybe start their own company, or really be kind of part of that next change moving forward.
So wave a magic wand, next few years, you achieve what you're trying to achieve with Tickit. What does that look like?
I think we remove all stigma around questions that are asked in the healthcare space, so that both when we are confronted with asking a question that you might not want to know the answer to, both patients and providers are willing to have that conversation in an open and meaningful way. We're seeing that change. It's a change of culture, it's a change of identity in the space, but we're slowly seeing that happen as the healthcare system changes. Our product helps facilitate that, but it's really a culture change that we're seeing.
So where can people go to learn more about Tickit?
Yeah, so you can check us out at tickithealth.com, and that's probably the easiest place to connect with us, or also on AngelList and LinkedIn, but or reaching me out directly.
All right.